Hello everyone. Myself Mrs. Suvarna Alatkatti, Assistant Professor in the Department of Pharmacology at Nalla Narasimha Reddy Group of Institutions. The subject that we are dealing here is human anatomy and physiology. And today's video we are going to discuss about anatomical terminologies. So the different terms that we use during the whole syllabus that we are going to study. So once if you understand all these terminologies properly, it will be very useful for you to understand the topics. In each and every topic you will come across all these terminologies which we are going to discuss in today's video. So please concentrate more on all the particular terms or the words that we are using here, which will be useful for you to study in coming topics as well. Okay, so coming to the regional anatomy. So we have two anatomies, that is system anatomy and regional anatomy. System anatomy is that every systems you will be studying in that. So there are 11 types of systems in our body. For example, nervous system, respiratory system, and endocrine system, digestive system. So different systems you will be studying, that is the system anatomy. Whereas it is a regional anatomy wherein according to the location, according to the place where they are situated, according to that you will be studying, that is regional anatomy. So regional anatomy example of three types are there. Head and neck, as the name itself indicates. Head, this is the head and neck region. This color completely head and neck region, in which face, skull, brain and neck, all these parts will be covered, that is head and neck region. And the second one is limbs. Limbs means that is the upper limbs and the lower limbs. Upper limbs means that is hands and legs, you can say. So the upper limbs, all this blue color, okay, the blue color is upper limbs, and this pink color, complete pink color, this is all lower limbs. Okay, so now the trunk means it has got three parts, that is this is the thorax, and this is the back, and then this is the abdomen, and then perineum and pelvis. This green color is perineum, pelvis and perineum part. So pelvis, this green, yellow and purple, and this brown color all together, this is thorax, back, abdomen, perineum, pelvic, all together they are called as trunk. Okay, so three regions they are divided: head, neck, and then the limbs, that is hands and legs, upper limb, lower limbs, and then the trunk, that is which includes the thorax, back, abdomen, and then perineum and pelvis. Okay, so this is about the regional anatomy. Now we will study the anatomical positions. Okay, so when you will be studying the anatomical positions, you cannot sit bend or upside down. You cannot take the anatomical position in any way. Okay, there is a standard position in which all the structures are described actually. So if you have that standard structure this way, then that allows you the precise and consistent anatomical reference will be there. So while when you are describing any structures anatomically, the position, standard position is this, in which a person is standing straight upright, and then the arms side by arms are at the side, and then the palms facing forward. Okay, palms forward and feet together. So this is the standard anatomical position in which you will be studying all different terminologies related to this particular posture. Okay, so now first one what we will study is left and right. You may feel this is very easy, what is left and right? So the left and right in anatomical position, it's going to be different here because what you see here from your side, it's going to be left and it's going to be right. So anatomical position, your right, your left is right, your right is left there. So this is right and this is left here. So whenever you want to specify any particular birthmark in your body, or else any spot in your body, if you want to specify, then how will you specify? If a pimple you have at point A, then you will specify this is towards the left. This is the navel or the umbilicus. So a point, how you will mention is that the point A is to the left of the umbilicus. So this is the navel or the umbilicus. The point A is left to umbilicus or the navel. Now after this we will study anterior and posterior parts. Anterior is front of the body is called anterior and back side of the body is called the posterior. Okay, so this is front part and the back part, anterior and posterior. So anterior, which is a front part of the body, that's also called as a ventral. Okay, ventral, whereas posterior is also called as dorsal. Dorsal and dorsal is equal, same as posterior, which is a back side of the body. So how you need to remember is that anterior, front, ventral. Okay, anterior is equal to ventral, which is a front side of your body. Posterior, that's the back side of your body, which is also called as dorsal. Okay, for example, navel. Okay, navel, which we discussed earlier, umbilicus, this is at your front side of the body. Okay, that's why navel is on the anterior surface of the body. Okay, whereas similarly heel, which is the back side of your body, so that how you will mention heel is posterior to the toes or the dorsal to the toes, because toes are in the anterior position or the front position. So the heels are now posterior to the toes. That is now anterior and posterior. Anterior front side, posterior back side. Okay. Now, with the example to say the sternum, sternum is a bone which connects the ribs. Okay, so within the ribs or the sternum rib cage, the heart is present. So now we can say that the sternum is front side and the heart is back side. Okay, now how you will mention that now? Sternum is anterior to the heart, or else heart is posterior to the sternum. Okay, because heart is present back side of the sternum. This is with the example. Now, after the anterior and posterior, we'll understand what is superior and inferior. As the name is itself indicates, superior is above, inferior is lower. Okay, so superior is that is above or towards the head. That is towards the head, any part that is superior, and towards the feet, anything that is inferior. Okay, below or towards the feet, that is inferior. Above or towards the head, that is superior. So if you want to mention any points like A, B, C, give an example here. So A is superior to B, B is superior to C, because they are all above. If you want to mention the same thing in inferior point, that is point C is inferior to B, because C is below, towards the feet it is, that's why it is inferior. Okay, but compared to A and B, now B is inferior here. Okay, so the above part, these are the something towards the neck is superior, something towards the feet is inferior. That is with the example, like you all know that the heart is situated here and the small intestine is present here. So now heart is at the superior position and the intestine is at the inferior position. So how you will mention heart is located superior to the small intestine and the small intestine is located inferior to the heart. Okay. Small intestine is below the heart and heart is above the small intestine. That's why it is superiorly present and this is inferiorly present. Okay. That is now the anatomical, according to the anatomical directional terms, superficial and deep. Superficial is something that is very closer to the surface. On the surface, if it is very closer, that is called superficial, and something that is away from the surface or deep inside, that's called as deeper. Okay, with the example to say, this is the sternum and these are the lungs. Okay, so the sternum, that is the superficial to the lungs, whereas lungs are situated deep inside. That's why lungs are deep to the sternum, that is superficial and deep. After studying all these terms, now we will study what is medial and lateral. Medial and lateral are concerned with the midline. Okay, so the midline is an imaginary line that you are drawing in the body. At the exactly at the center, you are dividing it into two parts. That's the imaginary line, not exactly. So that imaginary line that you are drawing in the center of your body, which is called as a midline. So anything that is closer to midline is called as medial, and anything that is away from the midline is called lateral. So medial is closer to midline and lateral is away from the midline or further from the midline. So example, if you want to say this is the thumb and this is the little finger. So little finger is near to the midline compared to that of thumb. That's why thumb is lateral to the little finger, whereas point A is medial, okay, that is near to the midline. B is lateral, that is away from the midline. That's why point A is medial to the B, B is lateral to A, okay, that is medial and lateral. That is with the organal example, that is these are the lungs and this is the heart, wherein these lungs are away from the midline, whereas heart is very closer to the midline. That's why heart lies medial to the lungs, whereas the lungs lies lateral to the heart. Okay, they are away from here, that's why they are lateral to the heart, and the heart is medial to the lungs. Okay. Now, after the medial and lateral, now we will study proximal and distal. What exactly is proximal and distal? So, this proximal and distal, you remember these two words you can use only when you are describing 2 points on the same limb. Especially this particular word is used for the limbs only, upper limbs and lower limbs. Maximum it's used for that only. So, you can use these 2 words only when you are describing any points in the same limb. 2 parts you want to mention, in that time only you can use this proximal and distal. Proximal means it is closer to where the arm or the leg is inserting themselves into the body. That these are the legs and these are the arms. This is the point where they are getting attached to the body. This is the point where they are getting attached to the body. So this is the whole body now. So to the body where the upper limbs or the hands are getting attached and the legs are getting attached, this particular point. Okay. So if any point that is closer to this particular point where the legs or the hands are getting attached to the body, that's called proximal. Any point that is away from that attachment, either feet or the wrist, that will be called as distal, which is away from the insertion point. Proximal is a closer point to the insertion point where the limbs are getting attached to the body. So anything that is closer to the attachment, that's called proximal. Anything that is away from this particular attachment, that is called distal. Okay. So example here is, this is knee. Knee is proximal compared to this ankle. Knee is proximal. Okay, this is towards the insertion point or the joining point. Okay, so this joining point, that's called proximal. That's why knee compared to ankle is proximal. And another example is wrist is distal to elbow. Wrist is a distal part. Compared to elbow, wrist is a distal part. Okay. Whereas armpit is proximal compared to elbow. Okay, towards this is proximal and towards this is distal. So with the example like this is a body, okay, which has a thorax, and we have discussed 3 parts which are there in this body. So anything near this body, that's proximal. Anything away from this body is distal. Okay, this is the body part. Okay, so anything near to this body is proximal, anything away is distal. And as I told you before only, that you can use this 2 terms only when you are mentioning 2 points at the same limb. In the same limb, when you are mentioning 2 points, okay, you cannot mention like point A is here, point B is here, which are of different, they are not a parts of one particular limb. Okay, they are different parts. So you cannot use proximal and distal here. Instead, you can use A is superior to B. Okay, not proximal. Okay. And as we have discussed all these things, anterior, posterior, medial, lateral, superior, inferior, and take all those terms and describe. This is just to for you to try. Describe the position of nose relative to eyes. Okay, not completely. Nose relative to eye. You just mention in the comment box what exactly. How do you specify this? How do you describe this position of nose? Okay, compared to eyes, means using the anatomical words which we discussed just now, using those terms, just mention, just in a comment section, you just mention the position of nose relative to eyes, and I'll give you the answer at the end of this video. Okay. So altogether, in a summary, what all we discussed is, this is the right side and this is the left side, and this is the midline. Anything towards the midline is medial, and anything away from the midline is lateral, and anything towards the body is proximal, anything away from the body attachment, that is distal. Okay, so anything towards the neck or the head is superior, anything below or towards the feet is proximal. Okay, and then the front of the body is called the anterior and the back of the body is called the posterior. Now there are another two terms like unilateral and bilateral. Unilateral is on one side, bilateral is on both the sides. Now, after studying all those basic anatomical direction position terms, now we will just understand what are the directional terms. Directional terms, when you all those terms which you studied just before, they are all morphologically you will be specifying some of the things. When you want to study the anatomical, when you want to cut the body and then see the internal parts, or the understand the internal anatomical structure or the position of the body, then you will have to cut the body in different sections. So that to cut the body into slices, that's called as planes or the sections. So in what manner you are cutting the organ or a part or a body, that will reveal different types of structures or the position of that particular organs there. Okay, so that is all called as a directional term. So describe, which will describe the position of external internal structures now. Okay. So the different anatomical planes in which the body or the organ is cut into is, one is sagittal, and the another one is frontal, and third one is transverse, and fourth one is oblique. So the frontal is also called as coronal, and transverse is also called as cross section. So these are the four types of sections or the cuts we make in the body. We will just understand those things now. So the first one is sagittal plane. Sagittal plane is cutting lengthwise. Okay, complete lengthwise you are cutting. That is the sagittal plane, wherein you cut along with the midline. Okay, cut any organ lengthwise in the middle along with the midline. That's called as a mid sagittal plane if you cut through the midline. And sometimes when you are cutting through the midline, it may not be exactly at the center. It may be a bit towards left, bit towards right. So when it is not exactly at the center and bit towards the left or the right, that's called as parasagittal plane. If you cut, if your cut is not through the midline exactly. Okay, so this is exact cut through the midline, that is the sagittal plane. And if it is if it is not exactly at the center either side, then it is parasagittal plane. And the next plane is frontal plane. Frontal plane, in sagittal you are cutting it like this. Okay, the body or the organ you are cutting exactly like this, whereas in frontal plane you will cut it like this. The front part and the back part will be divided. Okay, you will cut it like this. When you cut frontally or frontal plane, you divide the body into front plane and the back plane. Okay, so front and back is divided now. Next, the third one comes the transverse plane. Transverse plane, what happens? You cut it horizontally, exactly in the center, or horizontally you give a cut to the body or the organ, that horizontal cut which divides the body into superior and inferior. That is the transverse plane. So for example, when you cut the brain in different sections, like different planes, when you cut, that is when you give a transverse cut and the brain looks like this. When you give a frontal cut, the brain looks like this. And when you give a sagittal cut, the brain looks like this. And you can observe here that the pons part of a brain which is not seen in both these sections. You can see this section, this particular pons in sagittal section only. That's the reason you need to have different types of sections depending on what part to be visualized or analyzed. Depending on that, different cuts are given to the body or the organ. The last one is oblique plane. Oblique plane, in which you will be cutting the body diagonally. Okay, diagonal cut is called as the oblique plane. Now, after studying all those things, now the final thing what we are going to study is different body cavities. Okay, body cavity, especially what is body cavity, is that it is a fluid filled space in which the different organs, it encloses the different organs. Okay, so it protects the internal organs by enclosing within the cavity. So the largest human body cavities, two different cavities are there. One is the ventral cavity and the other one is the dorsal cavity. Two important categories. They are again subdivided particularly. Otherwise, to say, only two body cavities, largest two body cavities, that is, one is ventral cavity and the other one is dorsal cavity. Okay, so two principal body cavities, again they are subdivided. One is, this is the dorsal body cavity and this is the ventral body cavity. Dorsal, this is yellow color is dorsal and the blue color is ventral. Okay, So in the yellow color, that is the dorsal body cavity, what you have is cranial cavity, that is the brain, along with the spinal cord. This is the spinal cord. So spinal cord and the cranial cavity comes into the dorsal body cavities, whereas in ventral, all these blue color, that is the especially ventral body cavity is enclosed thoracic cavity and abdominal cavity. Major points to say. Otherwise, what it has is thoracic cavity, diaphragm, that is just above the stomach or below the ribs, diaphragm is present, and then the abdominopelvic cavity. Abdominopelvic cavity, you call it because a combination of abdomen and pelvis. Okay, both together you may mention it as a abdominopelvic cavity or else abdomen cavity and pelvic cavity. All together in ventral body cavity, what all you have is thoracic cavity, diaphragm, abdominal cavity and pelvic cavity. Okay, so whereas in dorsal body cavity, you have cranial cavity and the spinal cord. Okay. So all that we have discussed different terminologies. Now what the question which I asked you, that we will just so the answer for the last question that I have given here, I hope most of you have answered in the comment section. So the answer for that question, to describe the position of nose relative to that of eyes, is the nose is medial, inferior and then anterior. Okay, front. Okay, front to the eyes. Medial it is, and then it is inferior to eyes, because eyes is superior compared to eyes, nose is inferior, down it is. Okay, so that's why. And the nose is towards the midline compared to eyes, nose is towards the midline, that's why nose is medial, inferior to eyes, and then it is front compared to the eyes are back and nose is front, that's why medial, inferior, anterior to the eyes. So this is all about the basic terminologies of human anatomy we discussed. Thanks for watching.